Hello and welcome back to another episode of Rebel Health Collective. Today we're diving into an eye-opening conversation that touches on a topic that many people may not know that is potentially the root cause of what's going on with their health, and that is mold toxicity. Joining us today is Jeremy Artiego, a guest who has personally battled this hidden health menace. For over 3 years, Jeremy has suffered from extreme fatigue, brain fog, and severe gut health problems. His journey involves ineffective treatments and a long search for answers that left him and his family frustrated. It wasn't until he discovered functional health that his life took a turn for the better. In this episode, Jeremy shares his raw and powerful story of resilience, how he identified mold as the culprit behind his health issues, the symptoms you may be ignoring, and the steps he took to recover using functional health approaches. You'll learn how mold toxicity can wreak havoc on your body and why functional health offers effective solutions. Whether you're dealing with unexplained fatigue, brain fog, or digestive issues, or you're simply curious about the impact of environmental toxins and the functional health approach, this episode is packed with valuable insights. Jeremy will also reveal practical tips you can apply in your own life to detect and combat mold exposure and improve your overall health. So if you've ever wondered how something like mold could silently impact your health, or if you're just looking for some encouragement to take control of your health journey, this episode is for you. Jeremy's story shows that sometimes the answers lie outside of traditional approaches. Without any further ado, let's jump into today's episode. Hey Claudia, thanks so much for joining us today. You have a really interesting story, and I'm really excited to be able to record it and get it out to others. You're one of those that has gone, through kind of the traditional medical route in solving one of your health issues, but you've taken it a step further and done some complementary treatments, which I think is really interesting. And when we first spoke, something that I had never heard about. I'm really excited to hear your journey and some of the self-advocacy and different tools that you used to better yourself and better the situation you were in. If you want to go ahead and give an introduction to yourself and start digging into your story, that'd be great.
Yeah. Hi, Josh. Thank you so much for having me on the podcast today. So I'm going a little bit back, like who I was actually before I was diagnosed with breast cancer. So I was the typical mother of 3 young kids and just scheduling all their activities and managing our household. I was on a parental leave at that time. And my youngest, he was 3. And then I have 2 daughters who are like 5 and 7. And my youngest he just started preschool. And that's when I thought, well, this is a good time. I'm going back to work. And I can also say I considered myself actually the picture of health. My diet was really good. I still kept exercising. I didn't make myself a priority, however. And I think every single mother with young kids, especially at a certain point when I had like 3 under 5, it's really hard to make yourself a priority. But then things came very different. I went in for a regular health checkup at my OBGYN, and she did also a breast exam. During that breast exam, she discovered 2 lumps, and she was like, well, are you aware about these 2 lumps? And I said, well, I just went in for a mammogram. I was my first mammogram at age 40, and that one was completely clear. So I was not too worried about.
How long ago was that mammogram? Was it pretty recently or?
Correct. So that mammogram before that checkup was a little bit over a year ago. It was my very first one. And I did it at the suggested age, or even on the younger side. It was actually optional at that time to get your first mammogram at 40, which I did, and it was clear. The only thing that mammogram said at that time was like that I had very dense breast tissue. I mean, there's another story to that. I didn't really know what to do with that information, and neither what it meant. I didn't know that it meant that you're at higher risk actually of developing breast cancer, and it's harder for the radiologist to spot tumors, which actually turned out just to be the case. When I went in for that checkup, she was like, okay, you need to go to get a mammogram again And I did, and they wanted to keep me there for a biopsy and an ultrasound. And even a radiologist at that time said, well, you're still young, and 95% of the cases, this should be just fine. And I kind of like, okay, let's just get this over. Of course, I was nervous about getting the biopsy and everything, but I went home and thought, okay, probably this is going to be turning just all right. It was not until I got that phone call, and I remember that phone call like it was yesterday, where the radiologist called me and he was like, I'm so sorry, Ms. De Pasquale, but I have to inform you have invasive lobular carcinoma. And that's when, my world was pretty much turned upside down. Not just my world, but everybody else in my family. Of course, it was a huge shock to us. And I didn't really know what to expect. And of course, one of my things was like, man, I have 3 kids. I don't have any immediate family in town. I don't have time for cancer. I just don't. And you're a parent, parenting is hard. And now we're adding this to the list. But I felt like I just didn't have any choice. And I just had to get through this. I had to get through this for my kids. And things moved very fast from that moment on. I was scheduled for to meet with my breast surgeon, and one month later, I already had my mastectomy.
And from getting that diagnosis and that phone call, did you have any period of like a poor me, for a better lack of words, or like a downbeaten and distraught, or was it just from the get-go, I'm gonna kick cancer's ass and I'm gonna take this head on and get through it, and I'm gonna come out on top?
Yeah, that's a very good question. So when I did get that phone call, I looked at my kids and I cried for a week straight. I thought, I'm gonna die. I'm not going to see my kids growing up. I was just in complete distress. And as a mother of young kids, I was not even worried about me. I was worried about my kids. Who's going to take care of my kids? And how can I get through treatment and taking care of them? But after crying 1 week straight, my youngest, he was only 3 at the time, he came up to me and he touched my arm and he said, Mama, I don't want you to cry anymore. Can you please stop crying? Please don't cry. And that's when something changed in me. I think my son and my other kids, of course, too, but that was just very touching, that moment. And I said, well, I can't keep going on like this. And that's when I started really changing. That doesn't mean that I didn't have any more sad moments, but it never really happened anymore that I just cried for weeks straight. And I decided from that moment on that I'm going to really kick cancer's ass. And I'm going to be, I want to show my kids how I can get through this challenge and how we get through this health challenge together. And from then on, I started really calm myself down as well. When I met with the breast surgeon, I started also having a lot of challenges in the beginning, like finding the right doctor and the right team.
What exactly were those challenges? Was it you were going in and just not connecting with the doctor, or what was causing you to continue a search rather than just going into the first doctor and moving forward?
So I was 40 at the time going through this journey. I learned also that there's a lot of women, even younger, being affected by breast cancer. Unfortunately, it's 1 in 8 women that is going to be affected by this horrible disease. But none in my friendship or in my circle, actually, or that I directly knew that was this young, that I knew locally, had gone through this journey. So I was looking for recommendations for breast surgeons. And the first time I met with my breast surgeon, I had so many questions. I wanted to know everything. And I was in an H&O at that time, which was great as long as I was really healthy. It was very well organized, everything at one place. But then I thought, well, if you have cancer, it's going to be like they're going to give you a little bit more time to ask your questions. And it was like she had like a stopwatch with her. It was 45 minutes on the clock. And I had so much more that I just wanted to ask. And the ultimate thing that she told me at the end of this meeting was like, hey, I have two things in my toolbox. It's either a mastectomy and a lumpectomy. And you can imagine like what a distress this is for a patient. And I didn't even meet with my whole team, with my oncologist yet. So they just said, well, that's what we're discussing now and everything else later.
Wow.
And that's really when I started to dig myself into listening to podcasts, starting to read, researching things. Like I wanted to know from other women, how did they choose? How did they get through this journey? And, further down the road, I also realized that you have to find a doctor that you're comfortable with, that aligns with your ideas. And that doctor in a stressing moment like that has to have really good bedside manners too, which this doctor didn't have. I ended up firing her because I wanted to involve my husband too in the discussion. Going a little bit back, I would have chosen to go the lumpectomy route at that time, because I said, well, why do I have to go like more invasive if I can just have a lumpectomy and be fine? And at that time, I didn't even know, like she didn't properly explain what it meant choosing one or the other option. I knew that the overall survival would be the same going lumpectomy, but often if you go lumpectomy route, you need radiation, as where you go the mastectomy route. Often you are able to skip radiation if you don't have anything in the lymph nodes, which they discover later once they go in and actually do the surgery. You don't know that beforehand. And because I wanted to do a lumpectomy, and my type of cancer is one of the not as common cancer. My cancer type doesn't always form a lump, and that's also important. If other women are listening this, cancer doesn't always form a lump. I had lobular breast cancer, and it can form kind of like spider-like structure.
Okay.
It can also just be a thickening or something. And that's why she wanted me to do a breast MRI. Once the results came out, it showed too much. It showed and that's often when you go into more detailed imaging, it showed too much. It showed like 9 suspicious enhancements that I have. And I thought, oh my God, this is even worse than what I thought it is. And based on that, though, she was saying, well, you do need a mastectomy. But to get the results and the discussion, I wanted to add my husband to the phone call. We were scheduled to talk at 10 o'clock in the morning. She called at 5, didn't even apologize. And I said, can I add my husband to the phone call? And she says, I'm sorry, I'm really busy right now. And that's the point where I said, no, I'm going to add my husband to the phone call. And I fired that first breast surgeon. And that's when I, luckily through a friend who was a doctor, I found another breast surgeon that I was much more comfortable with. So that was like one of my first hurdles. And I think really helpful was that at the end, through friends and connection, I was able to find another survivor who had gone through a mastectomy, because I was really scared too. And just getting these insights, that was like super helpful for me.
And that's so important that people understand how much of a partnership it is with your healthcare team. At least for me, before I started going through all of my medical fun, I thought that the care was standard across the board. For every specialty you went in to see, they were kind of taught the same things, obviously by different schools, but going from one doctor on one side of the road to another doctor on the other side of the road, I didn't know how vastly different their care could be. And like you mentioned, how much they could be partnering with you and trying different things and communicating. And so for a lot of people, I think they go in and see a doctor and they think, I just needed to roll with them. I need to start this, get it over with. But partnership and feeling comfortable with whoever you're working with is such an important factor. And definitely being able to include your partner and family, because they're the ones that are
Yes.
going to be taking care of you
Yes.
and definitely responsible for supporting you. So that's really huge. And I'm glad that was an eye-opening moment for you. And you're like, no, we're done here at this point. That's really cool.
Yes. Yeah, that was one of it. And I realized also how important it is to, at that point, because there are differences across the board. It is so important, to get a second and a third opinion. As I went further down the road with my treatment, that was even more true, having like several opinions about your treatment, because medicine is not black and white. There are gray zones. As I said, like find a team that aligns with your idea, but don't be afraid. In the beginning, I felt so bad about like questioning, getting a say. Everybody, especially when you are confronted with the disease like cancer, for example, everybody is getting second and third opinions.
As much as we owe healthcare professionals for all that they do, we don't owe them our business or our health or anything like that. I faced something similar
Correct.
with my first endocrinologist. He was an older guy and was pretty dead set on his way of doing things. And for him, it was doing the multiple daily manual injections. So you had like an insulin pen and you injected multiple times throughout the day. And I wanted an insulin pump because I thought it was going to make my quality of life better, make things easier. I was forgetting my pins all the time because we just had our son. And for me, that's something that I wanted. It was technology out there that I thought would help my disease. And he just really wasn't a believer in them. So he wasn't prescribing them for his patients. And at that point, I need to find somebody else that's going to be aligned and up to date with the newer technology. And because that's where I was at, I wanted to be always upgrading and incorporating the newest things that are out there. So I
Yeah.
totally agree. You've got to find someone that's on your level.
Yeah. And just similar like you, where I had to have injections to boost my white blood cell count. So once I was done with my mastectomy, the good news for me was that I didn't have anything in the lymph nodes, but then another setback for me at that time was, wow, not only did I have to get the mastectomy, I did need chemotherapy because my cancer, they do a complicated genomic test, and it showed that my chance of recurrence was quite high, even though they told me in the very beginning I had the favorable cancer, which was hormone receptor positive, which 80% of the women are hormone receptor positive breast cancer, so it's ERPR positive, HER2 negative. And of course, I didn't find that there's anything like a favorable cancer at all. With the chemotherapy, as I started, I went in and I thought, I'm healthy, I'm strong, I should be fine with side effects. And I was hit by every single side effect that I could get. I had 4 rounds to complete, and like I lost all my hair, I had lost my breast, and then now I also started having rashes and mouth sores. I couldn't swallow. I was so fatigued that it's hard to explain if you haven't gone through, but I was even so tired at a certain point that it was too hard for me to lift the blanket off of me, even though I was so hot. And my husband said, well, you had your phone right next to you. Why didn't you call me? And I said, you know what? Even that was too much work. I didn't want to go to the bathroom. It was so bad with all the side effects. And that's also very individual. That doesn't mean like everybody has all the side effects. And it doesn't matter if you're healthy and strong. But that's when we started talking about a dose reduction of chemotherapy with my oncologist. And I said, well, aren't there other ways that maybe we can keep the dose, but we change other things? I said, maybe I can adjust my diet or whatever. So at that point, I started also reading a lot about alternative therapies and also story about other survivors, how they were able to cope with side effects. So I said to my oncologist, well, can I try, just give me one more try. I'm going to try alternative things. And she says, well, let's try again. And I did. We started at that point, really like tweaking my diet. I had a certain regimen that I was following going into chemotherapy. I started sucking on ice during the treatment, which would help with mouth sores. We started juicing. I started reading that beet juice can help athletes to improve their performance. So I was like, well, maybe it helps with my fatigue. So we did so many other things, and I started meditating, just like able to manage the stress better that came with all of this. I went into my second round and I had none of the side effects.
And so what, just for the listeners, what, and for me, honestly, because I don't know the normal time frame, you did one round of chemo and you had the fatigue and symptoms that you listed out. That came from just the first round. And then
yes, I had the fatigue, the diarrhea. I mean, you name it, like every single box that you could check, all of them, the whole list of side effects.
And going into your second round, because of those extreme side effects, you guys were talking about potentially downing the dose, decided not to. And what was the time frame from the first treatment to that second treatment where you incorporated a lot of these, like, I guess, care technique changes?
It was every month I had a round. So it's kind of like it gave the body the time to recover. So we, within that month, pretty much like we changed all these things, but we changed it also as a family. So my husband was helping me because it's a lot of work to choose and to change the diet. And so it was about that time frame. But I was even surprised, like I didn't suffer any of the side effects. And my energy, actually, it was not like, oh wow, like great, but it was like a lot better. I actually was able to even like do some exercise and keep our routine steady with my family, because I actually am able to play with my kids because my energy levels were better. And it's expected actually that with each with each subsequent round of chemotherapy, it should be the contrary. Your energy should go, you should get weaker and weaker. For me, so that was not the case. So for me, just changing my lifestyle helped me to cope with all those side effects just so much better. When my oncologist asked me, so what did you do? She didn't even ask me really. She was just surprised, and I was kind of wanting to push it like, hey, look, I did this. So I told her about certain things, and she was just kind of like laughing a little bit. I'm very grateful for Western medicine, and it does have its place. But when you are with a doctor that is not a integrative oncologist, or you don't have any integrative care that adds traditional treatments or conventional treatments and adds alternative treatments to it, it's just like a doctor is usually, a traditional doctor is usually not trained in that. And I was kind of like shrugged off a little bit, like, yeah, whatever. She was not even interested in really knowing what I did, because I was like, hey, this could be important for your other patients.
Right. This could be a protocol that you can give out to people and say, hey, if you want to do this, great, but here's some stuff that has worked for others. I mean, it's not a guarantee, but we've seen success with this, or at least, something to keep an eye on. And for other people that were hit as hard as you were initially, if maybe it was the third round and people started having some of the symptoms, but if someone's getting hit in the very first round of chemo like you did, why not spread some of that information?
Exactly. But they don't. So a doctor is not going to do that. And that was a big shock. And I think that journey then at that point taught me like the importance of whole person healing, to add these things, because I started to do so well during the chemo after I added all these other things to it. A lot of people always think about like exercise, diet, but it was also mindfulness techniques that I started to integrate. I was always on the go. I'm always looking for the next thing, the typical overscheduled and busy mom. So I started to meditate. I started to learn mindfulness techniques. I started doing hypnotherapy sessions as well. Things that I had never done. And I truly believe that all these things, they helped me just to be calmer, manage my stress that came with it. But it was the whole package, of course, tweaking my diet. It was that I kept exercising. It actually helped to keep my energy also steady. I mean, all of that, and then embracing really the support of the community and my family. Something that as a caregiver or a busy mom, it's just really hard, because you're usually the one who who helps others, right? You're always there for the needs of your kids. So now I was once in a role, and it was really hard for me in the beginning to ask for help and to accept help. So that's something else that I did. I really started reaching out, and I reached out to our school, to our neighbors, to the community, and a lot of nonprofit organizations, family, friends. I mean, all of that. It was the combination of all of that that supported us through this journey. I think like it was the whole package that helped us get through it. And all of that, I think once I was like realizing the importance of whole person healing, but also the power of advocating for yourself. I think that's another big one. That led me to creating a blog, which is my cancer diaries. Because in the beginning, it was kind of like I started writing down my story and taking picture and documenting everything, but it was more of a therapy to me. But I didn't realize that just writing everything down is not only healing to me, but this could actually help someone else to bring that out there. So that's why I became a breast cancer advocate. And I started to write my blog. That's why I'm out here now talking about it, because I think people need to hear this.
I totally agree. And I mean, that's the main point behind why I started this podcast. I felt like the 3 years of what I've gone through in my medical journey, I can share that, whether it's not hospital, the doctor's visits, the self-advocacy, some of the things that I've learned through having to fight with insurance. I've dealt
Yeah.
with things that have taken me a long time to figure out. And if I can spread that knowledge to someone and get them there in half the time, a fourth of the time, then that's the goal. And if it's 3 or 4 people, that's more than enough. So I appreciate you for doing that. And I know it's a big step in being vulnerable and putting a lot of information out there and
Yes.
really opening yourself up. But I'm sure that your work has helped people, and I really appreciate all that you continue to do. It's enough to deal with cancer and beat it, but to continue with kind of some toes in that world and a constant reminder that you had to go through that. I know that can be really hard.
Yeah, it is. As I said, it's hard, but it brings a lot of fulfillment as well.
Yeah. And just the few people that have reached out from the podcast, from either starting with a type 1 diagnosis or just relating to other people's stories. I mean, that's a huge motivation just to keep going and knowing that even a couple people are getting something out of what you're putting out into the world. It means a lot. And it's not a Ponzi scheme type thing where you're trying to get rich. It's just truly trying to make the world a better place and help others. So thank you.
Yes.
And we will put your blog link in the show notes. So for anyone that is going through breast cancer, has a loved one, a family member, friend, whoever, we'll make sure that they have the resources to check that out.
Yeah. Thank you. I really appreciate that. And I appreciate too what you're doing. I think because there's so many parallels between all the chronic illnesses. And I realized that too going through treatment, because I think you get more sensitive also hearing other people's stories. Even though you and I have a different chronic illness, there's so many similarities, like realizing that doctors are not trained when it comes to alternative or complementary treatments. They get so little nutrition training. You can get a lot of pushback from doctors even when you come up with stuff like that. And the realization that medicine is not black and white, finding the right team, get those second and third opinions, that you have to advocate for yourself. You brought a nice example too with quality of life, that you wanted to pump instead of the injection. So I faced something similar when I had to go in for chemo and get those shots for boosting my white blood cell counts. I had needle anxiety at that time because I had already been poked so many times. And I was like a kid. I really was like almost like, of course, I couldn't go in like that and crying. But that's exactly how I felt. I really didn't want to get poked again. The shots that the oncologist had ordered for me was like shots that I had to do 5 times in a row into my tummy without even ever showing me how that works. So the only thing that I got from the nurse, because I went in there for my infusion, and they were telling me, oh, they can tell you how to do it. And the nurse was just saying, but diabetics, they do that all the time. I was like, I've never been a diabetic. I don't know. I don't want to self-inject myself in the tummy, and I'm sure there's another way. So I didn't appreciate that. And I started again, like reading, like, is there another way? Of course, there was a shot that you could just get like once per cycle, and you could get it at the injection clinic. Of course, I found out that that shot was a lot more expensive, so it's struggling with the insurance as well, because the doctor is also going to recommend to you usually what's more cost effective. That doesn't mean that's the best for your quality of life either. So I had to advocate, and I said, well, I'm just not going to do this. I do want this. I know that there is another suggestion, and I know that there was a protocol that you had to fail. I don't know, you had to do it for so many days. And if it was not effective, then they were going to the one-time shot. And I just kept pushing and pushing and pushing my doctor. I was like, I'm not going to do this. And I said, I have a meltdown here. Like, I do want the one shot. And only then, after complaining so much, which we have to deal with a lot going through journeys like this just shouldn't be the case. And of course, it also depends where you're treated. It's not always the same.
Yeah. And unfortunately, I have found that to be the case in some of my stuff. Is there's like a standard of care or a standard option, I guess, that's put out there.
Yeah.
And that most of the public is okay with. But those other options that might be more costly, might take longer, maybe more effort, those aren't really talked about. I mean, they're not laid out in the options, where it's like, for maybe 90% of the people, they'd be fine just self-injecting. They would rather take the cheaper route. But for those like yourself that had some sort of a mental block or weren't able to, whatever the reason may be, that option just isn't initially put out there until you dig deep or press hard enough into the healthcare team. And that's unfortunate for sure, because like with dieting and things like that, I use fasting a ton for my diabetes management, and it's gaining a ton of traction within the diabetic community, but it's not really an option that they talk about when you go into the doctor's office. And my endo is really good and supportive of it. And I've asked him, like, why isn't this brought up initially as a tool? Because it's really becoming recognized as something that you can do. And his answer was that most people won't utilize it. They don't want to put in the effort. They want to just keep eating the foods that they're eating. And while I understand that, why not at least, touch it softly and see if someone's interested in it? Because I would have taken it up right away. If I would have known it would have made managing my blood sugars easier. But just because most people wouldn't do it, it's not being talked about.
Yeah. I mean, I think that's the other side of the story. So you have to advocate for yourself, but then like all the things you do, lifestyle changes, you touched it, they're not easy, they're hard. You have to put in the work. And my treatment, I mean, it is over. So once I finished chemotherapy, chemotherapy put me in medical menopause at age 41, which is really early. And I started hormone therapy, which keeps me in medical menopause because estrogen has been driving my cancer. So I'm still on maintenance to prevent recurrence. Those medications and being in menopause so early, of course, has a lot of side effects too. But I had to change my lifestyle even further, because being in medical menopause, it affects my heart, it affects my bone density. You can gain weight, your muscle mass decreases faster, all of that. So I changed also the way I exercise. I used to do cardio, now I lift weights. I tweak my diet even further. It's like all these things. So there are big lifestyle changes, and I incorporated them with my family. They're very supportive of it, but it is work. They work, but you have to make it a priority, which is not always easy. I understand that too. And usually doctors just want to prescribe you another pill for another side effect, but then you realize it's a chain. So you have one side effect, you get another pill, and then that pill makes you another side effect, and it just keeps going. And like your medicine cabinet just keeps growing and growing and growing. And at the end, you feel even more miserable. I mean, that's just like my experience. And that's why I'm always like, yeah, there is a place for drugs, there's a place for conventional treatment, but why not try the natural route first? See if it works. It requires effort. And if it doesn't work, then there is always still, yeah, you can grab that pill. So that was my approach. And I think like I did really well with it and I coped well with all the side effects. I gained a lot of my vitality back and I'm doing everything like I'm working out and I don't have any lasting side effects from my treatment either because I did a lot of the alternative things too. Like also I iced my hands during chemotherapy so to prevent neuropathy, but they were not very clear about that either because once you put ice on your hands and your feet, the chemo drug doesn't go in there. So some women do cold capping. I didn't do that, but it's the same idea behind that it constricts your blood vessels and the chemo drug doesn't go in it because I was scared of neuropathy because it's a long lasting damage. I said, well, I have 3 small kids. I do still need to be able to use my hand and my feet and all of that. So I made it a big effort and did it hurt to have my ice, my hand, my feet iced for sometimes I was in an infusion chair for 7 hours. Yes, but I did it. And all of that was a big effort. And I kept eating like ice chips too to prevent all the mouth sores. So that's another thing I did. But do the doctors really talk about all these things? Not really, not that much. It's kind of mentioned or brushed on the side. And I think that's very unfortunate because it can change not coping with your side effects, but also preventing side effects popping up in the future.
Definitely. And for just out of curiosity, for the hand and feet, like putting those in the tubs of ice, was that something that the doctor's office helped with? Like you said, I want to do this. Did they help like over those 6-7 hours? Were they refilling the
Of
ice?
course not.
That was like your husband
Of course not.
doing
No.
that stuff?
Well, so I didn't put it in ice buckets, but I had like these gloves.
Okay.
And I got them off Amazon.
Gotcha.
You get kind of like they have gel pads, and I went with my big cooler so I could change them. And I was someone who usually other people have been tolerating the chemo and got, that depends too, varies from person to person. I had allergic reaction and tolerated the drip only super slowly. So that's why I ended up being in the chemo chair so long, but not the nurses don't help you. So it was like I had always a friend coming with me and they kept changing the ice boots and the gloves and feeding me ice and I was sucking on. I mean, I couldn't even, have my hands that I couldn't really use. My feet were on ice. And then like my friend or whoever was my caregiver, it switched from infusion to infusion, kept feeding me ice. And I didn't have problems with swallowing like that. And I didn't have those horrible mouth sores that I got with the first round when I didn't do that. So it could be that someone goes in and doesn't get it in the first place. It doesn't mean that everybody gets it, but it's a great prevention to do it. But did my doctor help or the nurses help me with it? No, of course not. You have to do that, which also I found, I saw a lot of like elderly people going into treatment and some of them were there alone, and it's kind of sad that assistance, I know it's a cost problem again. We're going back. It all comes down to money. But there are things that you can do, and unfortunately, all these complementary things they cost money, and if you don't do them yourself, then nobody does them for you. But yes, I really think that the doctors or the nurse navigator, whatever, they should explaining I had to do the research, where to find the gloves. I purchased the gloves and all of that. That was I put the effort in it.
Yeah, and it just goes back to advocating. The resources may not be there, but that doesn't mean you can't bring them in or incorporate them on your own. And
Yeah.
One other thing that I really wanted to touch on that you've mentioned a couple times, but I know when we did our initial tag up and met each other, you had talked about your family and their support. Was it just we're here for you and whatever you need, just ask and we'll do it? Or did they incorporate a lot of the changes as well? You mentioned juicing, for example. Was your husband making you juices, or was he also drinking juices and incorporating that into his lifestyle as kind of like we're going through this together. I'm going to support you and be a part of it.
Yeah, I think like they did some of the jam. We were already very healthy to begin with, so I didn't typically eat packaged
You
foods
didn't
to
give up
begin
McDonald's
with.
or something.
No, actually, my kids have never even tried it. I think we're a little strange when it comes to that, but so we were healthy already, but I took it a little further, and I'm pretty much like following like an anti-inflammatory diet, nothing extreme. We eat all food groups. I'm not vegan or nothing extremes, but it's we eat nothing comes out of a package. Let's put it like that. And yes, my family were on board like integrating these things as well. So now we made it a habit so we have like a place where they juice vegetables and fruits here in town. And when I was going through treatment, I did it myself. It's a lot of work. But now we go every Friday, and my kids, they actually like it too, some of the juices. So yeah, they drink it too. So sometimes they kind of make fun, of me because, it's like, yeah, mama who eats always all these vegetables, and they're bringing their lunches to school, and other kids ask them what their lunches are. What is a bell pepper kind of question where everybody else has Lunchables. So yeah, we did incorporate all of that as a family, and we all tweaked everything when it comes to food, but also I changed also like cleaning products that we're using to go to less toxic alternative. The products that I use for personal care products like creams, lotion, and all of that, I did swap a lot of a lot of products as well that are like non-toxic. I'm trying to educate my kids from an early age on to read the labels and be aware, because I didn't know that either. I thought too that things were regulated here. And then you find out when you dig a little bit deeper that there is actually not that much regulation when it comes to personal care products and cleaning products. And it can, now what I'm saying, it all sounds, and if I put myself back before cancer diagnosis, it all sounds very extreme and very overwhelming. So you don't have to do this process overnight and change everything. No, but it's a process. And I talk a lot about this, like also on Instagram, swaps that I did with cleaning products and choosing healthier options that can work for a family with kids as well. So
it can,
yes.
and you're 100% right, where it can sound really extreme, but it's not something that you
Yes,
need to wake up on a Sunday and throw everything in your house out. You can gradually do it.
exactly.
And that's what my wife and I
Yes,
are slowly kind of incorporating. Like, we got rid of the plastic cutting boards now and are using wood.
yes,
We're not using
yeah,
plastic cooking utensils that you put in hot water, and
yes,
it's things like that we're not dropping $1,000-$2,000 to redo the entire kitchen and the utensils, but making small swaps over time. And just as you become educated, just keeping your mind open and
yeah,
understanding that, oh, when I cut up these strawberries that I'm trying to eat to be healthy on this plastic cutting board, all these nanoplastics are getting wrapped up
yeah,
in those strawberries, and then I'm eating
yeah,
them. So it's things like that can seem
yeah,
extreme, but once you break it down, it's like, that makes sense. I could see how that could affect us over time.
yeah. Because I think like when you're affected by a chronic illness like that, of course, there's always the why. There's always the question, why did it affect me? And I know with cancer, a lot of people think it's in the genes because the mom had it or whatever. No, this is not true. So 10% is actually due to genetic components. I had like a genetic test too. They test like 87 genes, and I don't have any mutation. And my mother My mother didn't have breast cancer, and I was, as I said, fairly healthy. But we know as of today that 90% are actually environmental factors. And that's like a whole bunch of variables that go in there. It's like, of course, the plastics that we have in our modern life, it's the foods that we eat, it can be even like the materials your house is built off, your clothes. Of course, now someone can say like, oh, there's no way I can cut everything out. Yeah, it is true. You can't cut everything out. But I'm trying to control what I can control nowadays, knowing more. And I'm trying to educate my children as well on, to make all swaps that you're doing over time, like the plastic boards or the cleaning products. There are alternatives. It's a lot of times actually going back to like how we used to clean too. Let's say like you're going from Clorox, you're going with vinegar and baking soda. You can clean a lot of things.
It is. And another thing that I've learned when going through a lot of this is, especially with COVID, we got really down the rabbit hole of disinfecting and getting rid of all of the germs.
Yeah.
And a lot of the cleaning things today, sure, they wipe everything out, which isn't always the best case. There's obviously things that you want to clean, and if your kid's pacifier falls on the ground, you want to make sure that's clean. But it's kind of like our gut biome, where there are good germs that are out there. And right now, with some of the stuff we're using, we're wiping all of them out. So it's almost like this super sanitary just blankness where you're not getting any of the good germs. So I've learned that through some of my research as well.
Yeah. And I think that's where those journeys teach you really about starting to question certain things as well. And I think that's why you and I are doing what we're doing, because I was like, wow, I wish I would have known that. Actually, why did it need a chronic illness for me to realize a lot of things? And I also get a lot the question like, well, you were already the picture of health. Why did you get cancer in the first place? So I always say like, yes, I was the picture of health already before, but I think that also helps you to get through treatment. So if you do get ill, you get through the treatments easier. So it's actually good to be strong in the beginning. If you're hit by a disease like that, you will cope with side effects and the treatments just in general better than if you already have like a lot of other
Right. Yeah. If you have type 2 diabetes, cardiac issues, and then get hit with cancer, you're at a lot higher risk of being hurt and damaged and long-term complications, versus if you were somebody who was active and pretty healthy to begin with. Completely agree with that. Well, we're getting close to time. Is there anything else that you want to touch on to make sure that the listeners take home? Any shout outs or ways that you want to allow people to reach out to you and contact you other than the blog?
People can definitely reach me either through my blog, which is mycancerdiaries.com, or I'm pretty active on Instagram as well. They can reach me over that, which is at my_cancer diaries. And also my blog is not only for women who are newly diagnosed with breast cancer. I do have a little bit the edge, like someone who is also a caregiver parenting young kids, like I was in my blog in general. But it's also for caregivers or supporters of a friend who has breast cancer. So they will find a lot of good information there as well. How to support a friend or a family member going through such a difficult journey.
Awesome. I can relate to that because my wife is such a big supporter of me, and she picks up the extra load on the days that I am just not able to do it. So that caregiver and support team and that community is such a big impact, and they play such a powerful part in someone taking on, learning, conquering a chronic illness and different things that are going on. So super important there.
Yes. And I think like sometimes caregivers or friends and family, sometimes they want to help, but they don't really know how. And I think that's where resources, whether it's a podcast or a blog or following someone on Instagram who went through a journey like that, can be really, really helpful. I did it myself. I was looking up people who had walked that path that I had walked, and now I'm spreading what I have learned. And I think that's where, if you really want to help someone, as I said, doctors, of course, they have their place in that journey. But I think people who have walked that path, they have a very important role in helping people who are newly diagnosed or walking chronic illness paths to learn from them, because there's a lot of lessons to be learned that your medical team won't tell you. Yes.
Very cool. Again, Claudia, thank you so much for your time today, coming on the podcast and sharing your story. I'm so glad that you were able to beat cancer and do what you're doing today and helping others. It's truly amazing.
Thank you so much, Josh.
Thank you for joining us on this episode of Rebel Health Collective. I hope that today's discussion has inspired you to take action and become an advocate for better healthcare. If you have a story to share or expertise to offer, we'd love to hear from you. We're always looking for new guests to join us on the podcast and contribute to the important conversations. Check the link in our show notes to set up a time to meet with us. We'd really be honored to amplify your voice. Don't forget to subscribe, leave a review, and follow us on Instagram and Facebook at Rebel Health Collective to stay connected with our community. Until next time, keep up the fight, don't back down, and stay rebellious. Take care.